Dr. John, recently our clients have been coming to us having suffered shin bone fractures. Is that a serious injury?
Yes, shin bone or tibial fractures are actually quite serious.
Dr. John, are you qualified to discuss shin bone fractures?
Yes, I have qualifications to discuss shin bone fractures. I went to medical school and completed an orthopedic residency, and I've actually treated tibial fractures themselves.
Can you help us to understand shin bone fractures by describing the relevant anatomy?
Yes, let's take a look at the anatomy on this particular diagram. What we see are actually two bones that make up the shin bone. One is called the tibia, and the other one is called the fibula. If you look at it from the front, which is this side of the diagram, the knee joint is up here, the ankle joint is here, and when we talk about long bone fractures of the tibia, they'll occur in this area, which is also called the diaphysis. This again is located on the posterior side here, and the back of the knee would be here, the back of the heel would be located here. Typically, if we're talking primarily about long bone fractures, the reason these can be quite serious is they're also just underneath the skin. So sometimes these can be associated with what's called an open fracture, or an old term is called a compound fracture, in which the bone actually comes out of the skin.
What function does the shin bone have in our body?
So the tibia or shin bone actually is involved also with weight bearing and ambulation or walking. The reason that tibial fractures are so significant is that if they're not properly treated, it can affect your weight bearing and walking.
For our clients who suffer shin bone fractures, what kind of symptoms do you anticipate they're going to experience?
Shin bone or tibial fractures, especially of the long bone, will be associated with significant pain. If they also have an opening in the skin that's related to where the fracture fragments have communicated with the outside, there's a high risk for infection, and that needs to be treated immediately.
Can you please share with us, how do shin bone fractures generally occur?
Shin bone fractures can occur from different levels of energy. At the highest level, where we see them, are with car crashes, in which typically the bones are in multiple fragments, and that's when there also can be communication outside the skin. A fall can also do it in a patient individual who has osteoporosis or weakened bones, and those sometimes can be treated with a cast, but the higher energy ones needed to be treated operatively.
How do shin bone fractures generally get diagnosed?
So shin bone fractures or tibial fractures are generally diagnosed with a good history, physical examination, but primarily and objectively with an X-ray. So what we're looking at here is a front view of the tibia and fibula or shin bone. And what we see is on the outside here, there's actually a splint has been placed to try and give the patient some comfort, although that's not the definitive treatment. Inside this splint, we can see here's the top of that shin bone that we remember what we looked at on the diagram. Here's the ankle bone on this side, and you can see that this bone has been completely disrupted in two different spots, and it's actually angulated and displaced. You can see also that there's some other small fragments, and that's what helps give you the diagnosis of the tibial fracture. In this particular case, there's also an associated fibular fracture, which means that the bone next to the tibia, or also again part of the shin bone, has been fractured, and it's been shifted to the side and shifted underneath, as you can see here.
Who is the right doctor to diagnose a shin bone fracture?
So the person or the physician that's can properly diagnose the tibial fracture and do a proper evaluation and recommend treatment is an orthopedic surgeon.
For our clients who suffer from shin bone fractures, what types of treatments can they expect to encounter?
So tibial fractures, typically, depending on the energy and the amount of pieces that the bone has been placed in after the fracture, there's a spectrum of different treatments. One can be treated with a cast if it's just a simple linear type of fracture, but in more severe fractures like the X-ray that we just looked at, those are treated typically with some kind of operative intervention. Let's take a look at this X-ray that shows how the operative intervention and what it looks like. So this is a front view of the tibial fracture after it's been treated with an intramedullary rod. You can see here the fibula didn't need to be treated. Basically, it's left in place like this. but the primary weight-bearing part of the tibia is, or of the lower extremity here, is the tibia. And you can see here this rod has been placed inside the tibia itself, and then 2 screws are at each end to hold it in place. You can actually see where the old fractures have been brought together, just like the pieces of a jigsaw puzzle.
For our clients who have suffered a shin bone fracture, could you tell us what does the future hold for them? What should they expect in the future?
Tibial fractures, again, can run the spectrum of different outcomes. In these high energy injuries, we want to try and avoid infection because that can make healing quite difficult. Also, because this is an area that is directly underneath the skin, sometimes you can have problems with healing. Those are called delayed unions or non-unions and sometimes require further intervention. The expectation, as long as everything goes well, of healing of the bone, typically you can return back to your weight bearing and regain your strength with appropriate physical therapy. But it does require a lengthy rehab as well.
Thank you, Dr. John.
Thank you, Mark.